Support for the Leadoff on WGLT and WGLT.org comes from the Central Illinois Regional Airport. The airport team strives to make air travel accessible to all through the Sunflower program, allowing individuals to self-identify when they need more assistance. More on the Hidden Disability Sunflower program at CIRA.com.
At first, the Pretrial Fairness Act reduced McLean County's jail population. It didn't last. That's one of the things you need to know to start your day for Wednesday, September 24th. I'm Ryan Denham, and this is WGLT's The Leadoff. Now let's lead off at the McLean County Jail, where occupancy sank 2 years ago when Illinois removed cashless bail. Since then, it's filling back up again, nearing an all-time high number of beds filled. WGLT's Lauren Warnicki has more.
Sheriff Matt Lane says jail occupancy was into the 150s in late 2023, but since then, population has steadily crept back up and now exceeds levels prior to the Pretrial Fairness Act that eliminated cash bail statewide. Lane says on any given day, they're now hovering between 230 and 240 beds filled. Critics worried crime rates would balloon without cash bail.
There is no indication of that.
Frank Beck is a sociologist with the Stevenson Center at Illinois State University. He tracks criminal justice trends for the county.
I mean, as far as I know, the number of bookings on new charges has not increased.
A primary cause for the ballooning jail population isn't new crimes necessarily, but pretrial release violations. Sheriff Lane says without cash bail, defendants have less skin in the game and miss court dates, sending them to jail. He notices this most with people whose charges stem from drug use and allows them to be immediately released.
And so they're immediately back to it, and they continue to miss court, whereas if they were held at least for a short amount of time to see the judge to set a bond and then come up with a bond, that sometimes gives them a break.
Statistics show the vast majority of defendants do show up to court, with one exception. Those facing methamphetamine charges are twice as likely to skip court dates. For The Leadoff, I'm Lauren Warnicki.
Here's some other stories we're following in the WGLT newsroom. Governor J.B. Pritzker is asking state agencies to start setting aside money for a potential economic downturn. An executive order tells agencies to put aside up to 4% of their budgets in reserve. The Illinois Department of Public Health has issued new guidance expanding COVID-19 vaccine access ahead of the fall respiratory virus season. That guidance recommends the COVID-19 shot for all adults and many children. And a motorcyclist from Bloomington has died following a crash in Woodford County. That happened yesterday morning just south of Eureka. Authorities have not yet released the name of the 42-year-old who was killed. You can find more on these stories at WGLT.org. A Bloomington-based nonprofit recently won a federal grant to study those who struggle with substance abuse. Chestnut Health System's Lighthouse Institute received a $1 million boost to develop strategies to reduce overdoses among those involved in the criminal legal system. WGLT's Lauren Warnicki is back with more on the research.
The federal government invests about $1 billion a year toward generating scientific solutions to the opioid epidemic. Chestnut Health Systems in Bloomington says no population has been more affected by opioid use than justice-involved individuals. That's a term applied to those who encounter the criminal legal system. Michael Dennis is Chief Research Officer for Chestnut's Lighthouse Institute.
About 1 in 4 people with an opioid use disorder are involved in the legal system during the past 12 months, any given 12-month period. So it's one of the easiest ways to find out-of-treatment opioid users.
Dennis says the research seeks to reduce overdose risk at any point in the legal system.
Can we find them in the community and keep them out of the legal system? Can we find them close to arrest? Can we find them in jail? Can we find them in courts and work with them in courts? Can we deal with them on probation, parole, or in prisons? And one of the highest risk periods for overdose and overdose-related deaths is when people are released from jail or prison.
Jail is a particularly high risk, Dennis says, since it's typically a shorter stay.
They are addicted. They came in. They may or may not have gotten services because there's such a high turnover rate of how short they're in jail. And they may go back out to the community in that first 90 days when they come out. If they're not linked to treatment, if they're not getting help, they often continue to use and will have a very high risk of overdose.
In a previous Lighthouse Institute study, about half of the people with opioid use disorders funneling through Cook County Jail had already overdosed at least once. A third had overdosed multiple times, some as many as 6 times. Typically a longer stay, Dennis says a prison sentence can create a stable environment for a person to detox fully and establish a routine with medical interventions curbing substance use. Risk of overdose leaving prison, however, remains high, he says, but for different reasons than leaving a jail.
You may have gone in with a 4-bag-a-day heroin habit, but you've been abstinent for years, and so you go out and you get some heroin, and you think that you've got a 4-bag-a-day habit, but you don't anymore because your body's adjusted to being abstinent. And unlike in the past, now most heroin is cut with fentanyl, which is actually cheaper and stronger.
The $1.1 million federal grant to Chestnut funds a 5-year study aimed at early intervention, curbing risk before someone ever enters a jail or prison. Another goal is facilitating conversation and collaboration between researchers and providers to ensure what they're proposing is both scalable and sustainable.
Scalability means we have to make it more portable so that other agencies can do it. And that is literally the focus of the trial, both of the 2 research trials we have. Sustainability means working like with Medicaid or other groups to help pay for it long term, because a research grant is 5 years and it'll be over. Our goal is not just to teach them how to do it and show they can do it well and that it's cost effective, but also to help work with them to get the funding codes set up necessary to be able to sustain it once we're gone.
Whether or not jails, prisons, court services, or community partners apply Chestnut's evidence-based recommendations, however, is another question. Dennis says most don't, and McLean County is better than most.
They collaborate with a lot of local providers, Chestnut for substance use, Community Health Center for mental health, and others. So they'll try to connect you with various services.
The national initiative has been expanded in recent years to include justice-involved individuals struggling with substance use beyond opioids like heroin and fentanyl. Chestnut also explores how abuse of alcohol or stimulants like cocaine or methamphetamine intersect with the justice system. I'm Lauren Warnicki.
And before we let you go, Bloomington's Public Safety and Community Relations Board meets tonight at 6. That includes a report from the new victims advocacy organization called Care for Victims. And that is it for today. I'm Ryan Denham, and the show is produced by Cheyenne Brown. You can subscribe to The Leadoff on the NPR app or wherever you listen.